Welcome to this edition of Labor Vision. I'm Bob Delaney, Executive Director of the Institute for Labor Studies and Research. Labor Vision, a production of the Institute, focuses on topics of importance to working Rhode Island families. We hope you enjoy this evening's edition.
Welcome to Labor Vision. My name is Tom Carr. For this segment, we've got our wonderful Secretary of State, Nellie Gorbea, with us. As I've said before, she is probably our hardest working public official, safeguarding our electoral processes for us. Madam Secretary, thanks for being here to explain to our viewers tonight that they don't just have to vote in person anymore. Can you give them an overview of their options?
Sure.
Now?
Absolutely. But I want to recap, because I know in a previous segment we did talk about voter registration, and
Correct.
I do want to throw out there vote.ri.gov, which has a lot of information, including how to do all of these different types of voting. But you have to be registered in order to be able to vote. So that's step number one. One of the messages that we want to make sure voters know about, because particularly in your case of our viewers or labor folks, they lead complicated lives. And you can't always go on election day during the hours posted. And so there are three ways to vote in Rhode Island. You can do a mail ballot, you can do an emergency ballot, and you can vote in person on the election day itself. And so we're trying to spread the word out, because for a lot of working folks, it's tough. I think that the reasons people don't vote are complicated. They're not just that they think that it doesn't matter, or, you know, I don't want to do this. I think we need to make sure that voters understand what are their options. So right now, for example, you can fill out an application to get a ballot mailed to your house. And so what you do is you fill out the application, we can find on our website, sign it, send it to your local board of canvassers. You'll receive your ballot in the mail to your house with an envelope that actually has postage prepaid. So you don't have to worry about that. You can fill it out, and then once you've inserted the voted ballot into the oath envelope, you seal it, and you print your name, sign it, then two individuals or a notary must witness your signature. So there's a process that's a little bit more involved, but that's to verify that you are indeed a real person that's submitting this ballot. And then you mail it, or you hand deliver it to your local boards of canvassers. The deadline for all mail ballots is that they have to be received at the Board of Elections on Branch Avenue in Providence by 8 p.m. on Election Day.
Okay. There is a process for actually getting those mail ballots in. It's in the envelope, signed and returned into the Board of Board of Elections, I should say. Okay. Yes. All right.
And we can tell you, you'll be able to tell in vote.ri.gov, like, you know, once you've applied, we've mailed you your ballot. If you feel like it hasn't arrived in a timely manner or whatever, like we have a way of, because we have tracking mechanisms on those to figure out where it might be.
And do you know when your ballot has gotten into?
Received? Yes, absolutely.
Even better.
Yes.
Oh, that's fantastic.
So now, if they miss the date for handling or mailing in the mail ballot, you can always go in person to city or town hall 20 days before the election. In those 20 days, there's a type of almost early voting, in the sense that you tell the clerk that you're there for an emergency ballot.
Yep.
They will give you an application. You will fill that out. They will notarize at that time your signature. You then are given the ballot. You fill out. Usually people just fill out right there and then stick it into this envelope again that helps keep your vote secret.
Right.
You just have. It's an easy process. It's a little bit paper intensive. I had a bill to streamline it by actually calling it early voting and having a polling location open. It didn't make it through the session,
right.
but I do want voters to know that there are three ways to vote. 21 days before an election, as of like right now, you could just print out that application for a mail ballot and have the ballot mailed to your house, and it'll have all the instructions, everything you need there. You can 20 days within, those 20 days before the election, you can do an emergency ballot at city or town hall. And then there's actual election day. Go to vote.ri.gov, put in their information, and then you'll see where it is that you need to go vote if you want to go vote on that particular day, what the deadlines are, what the process are. We have very simple instructions online so that you can vote.
Take advantage of what you guys have got out there. Take advantage of the website because it's updated. I'm
proud to say that all of our apps are being developed in-house by state employees. I mean, on occasion we've had to, you have contracts with people and stuff, but it's really managed and developed by state employees. And so I think that rather than go to like another website or get information elsewhere, go to vote.ri.gov.
Yeah, you guys do a great job with your website. I mean, we use it all the time in our office. I mean, it's a great tool. So we use it. There's no doubt about it. If you have, I mean, it is. I'm talking about it glowingly already, so it is a success. I know a lot of people take advantage of it. So would you consider expanding it going forward? Would you reintroduce that bill again for early voting, do you think?
Absolutely. I'm going to continue to have this conversation with the legislature. I think people want it. I mean, we've seen in emergency ballots alone, we've seen a huge increase since 2012. And that was part of the reason why all the clerks actually supported the bill, because they understood that this very paper-intensive process of the application and the secrecy envelope and all that could go away if you just have an open polling location 20 days before the election. And so, yes, I will be resubmitting that legislation. The other thing that my bill did, which I'm sad to say didn't make it through either, is I would love to see 4 hours on a Saturday, 4 hours on a Sunday before the election. Again, for working people who have like really strict Monday through Friday kind of timelines, they can't make it to city or town hall. In my case, I live in North Kingstown. I work in Providence. I mean, for me to go back into town to go vote basically would take the entire lunch period by the time you get down there and you figure out, so where you're going. So I want to make it as easy as possible for working people to be able to exercise this really important right to vote.
And I'm pretty much in the same situation. I live in Charlestown and work in Providence. So
so you're not taking your lunch hour to go down there.
There's no lunch hour for me to go down and vote. So it's like I either have to get there first thing in the morning and hope there's not a long line. And I think, in 2018, there were issues with lines and people getting shut off in certain places, not like every place.
Yeah, I was going to say, we only had a couple of places.
I think it was mostly Providence and Pawtucket, right?
Pawtucket, and a couple of places in the east side. We've actually tackled that with the Board of Elections, who manages Election Day, to try to make sure that doesn't happen.
Right. So, I mean, it's just, that's something.
But it's more the inconvenience of just having to go down somewhere. So if you could do it on a Saturday or Sunday, it'd be
have
much
a place
easier.
Open on a weekend.
But it's not happening this cycle, unfortunately.
No.
So let's go back to what we can do.
Right.
You can, however, get a ballot mailed to your house.
It's near and dear to my heart. My son puts in for the mail ballot because he's in the Peace Corps and he's in Morocco, and I've already checked with him and he's already done that. So we're taken care of there. So like I said, it's something that we take care of. But now, like we wanted to focus on vote.ri.gov. So how about we talk about that a little bit? I mean, there are things people can do there. So why don't we talk about your website a little bit?
Yeah, no, absolutely. So there's a lot of things that you can find out on the website. First and foremost, whether your voter information is accurate. That there doesn't have to be some sort of updating to your voter information. Right. Help us keep clean our voter lists, and you and everybody else in your family can help us do that. So by going into the website, because you can actually edit and fix any kind of issues in terms of having moved or new information. That's really important. If for some reason things get jammed up and you can't find yourself, this sometimes happened if you've changed your last name, or in the case of Hispanics, like me, we have 2 last names, and sometimes people forget, did I register under Nellie Gorbea or Nellie Gorbea Diaz? So we can help you at the Division of Elections at the Secretary of State's office. And you can just call 222-2340, and somebody will be happy to help you.
A section for people's voting rights. Why is that important for citizens?
Voting right, it is so important for us to know of our voting rights. And so that's why we put that on the website. A lot of people have, even died so that we can have these voting rights. The other thing that I want to make sure that people understand is while we do have a photo ID requirement here in Rhode Island, if for some reason your driver's license has expired when you get to the polling location, or you changed purses and you didn't bring it with you, if you don't have time to come again, or you just don't feel like coming back again, you can ask for a provisional ballot at the polling location. There is no reason why anyone on election day should be turned away without voting. You tell the poll worker that you need a provisional ballot, fill out the application, and then the election officials decide whether or not you're an actual duly registered voter. That's the check and balances process. But that's something that's very important to me, because I know I've heard on occasion sometimes because of confusion, people don't know, they don't ask. The poll worker may have misunderstood the instructions, and so if you have some sort of issue with the photo ID, the solution to it is to ask for a provisional ballot.
Okay, so people at the ballot box need to have an ID. Okay, that's important.
It's a photo ID, and it's actually, you can find out more about it on our website as well.
Okay, and we talked earlier about people can also find out how they can get more involved at the polling place.
That's right.
By becoming a poll worker.
Yeah.
Okay.
No, so I would love to see more people at the polls representing the true diversity of Rhode Island electorate. Mm-hmm. And so, in fact, last election cycle, I actually had a program with Amica where they actually gave some of their workers who volunteered to want to work at the polling locations, they let them have that day without having to count against their personal or vacation. Oh. Because I think for a lot of working folks, that's part of the challenge is, I don't want to take a personal vacation day to go work at the polls for 16 hours plus the 3-hour training. But I want to encourage anybody who might have that flexibility to join up and help us staff those polls on election day. You get trained by the Board of Elections to do it. I did it myself in one of the primary cycles before I was Secretary of State. It's hugely informative. It really helps you understand how the process works. There's a lot of checks and balances that I think protect our right to vote. And if you have young people, 16, 17, 18-year-olds, they love them at the polling locations as poll workers. You can absolutely work as a 16 or 17-year-old in your town. So have them sign up, do the training, and for them, the money is always good.
Yeah, I think it's funny because I worked there. I worked in a couple of polling places when I was in college, and I thought it was hysterical because I was working with people who were like my grandmother's age, and it was an intergenerational thing.
It is.
And it was the talk going back and forth was just hysterical. It was it's like, it was good play. It was like a play going back and forth.
And it's a real community building exercise.
Absolutely.
I think it really, particularly for 16 and 17-year-olds who can't yet vote, it gives them that feeling of being a part of something. And I think really helps instill in them the importance of voting. So I absolutely encourage anybody who has a 16 or 17-year-old who's pre-registered to go ahead and do this, because it's a great experience. Okay, well, thank you very much. I think we're getting towards the end of this episode, so thank you very much for coming on and coming in today and letting people know exactly what they need to do for this year's elections. Thank you so much. Thank you very much. And thank you very much for watching Labor Vision.
Good evening and welcome to this edition of Labor Vision. My name is Jim Riley. I'll be your host tonight. We've got a great guest tonight. We've got a healthy show tonight. We're going to be talking to Dr. Lee Okurowski, who is the Medical Director of the Rhode Island Occupational Environmental Health Center of Rhode Island. I got through that all right. Okay, so tell us about yourself, and then we're going to talk about ergonomics.
I'm the Medical Director here at the center, and we provide consulting medical services for members and the general public on work-related issues and illnesses and injuries. And we also provide services to the general public regarding environmental exposures. So good to be here and good to talk to you about some ergonomics. Yeah, let's talk about ergonomics. You know, I was a meat cutter. That was my career. And
we had a lot of repetitive movement, you know, working with knives and whatnot. And I had a couple of problems. I had Dupuytren contraction in both my hands and had to have operations. So I'm well aware of the ergonomics. So tell us, what is, for the layperson, what is ergonomics?
Ergonomics really is just the technical term for the study of work. But as it really applies in this setting, it's focusing in on fitting the task to the worker and really making sure that jobs are designed appropriately for those who perform them, as opposed to the other way around, just creating a job and slamming an individual into that position. That's when you get into trouble. So the focus of ergonomics is the science of really studying how we can best adapt the job to the individual.
So who needs to know about ergonomics?
Well, I mean, in the biggest sense, it's really all employees, employers, labor organizations, but focusing in on specific aspects of certain trades, it's really those where we have forceful, repetitive movement in potentially awkward postures. And where we really see that is in everything from healthcare to construction, maritime, meat packing, but also the office environment. So it's a pretty ubiquitous area, and people really need to be understanding, even in the home environment. Data entry, working at computers, et cetera, are all potentially ergonomic hazards.
So musculoskeletal disorders, or MSDs, tell us what they are.
That's really, MSDs is really the injury that results from poor ergonomics. And those are soft tissue injuries that occur to things like muscles, tendons, ligaments, joints. And in your example, Dupuytren's contraction is an example of a very well-known musculoskeletal disorder. So from a medical perspective, that's the disease outcome of poor ergonomic exposure or poor ergonomic design for the individual or worker.
What causes these musculoskeletal disorders?
Well, when we look at jobs ergonomics, we really focus on a couple key risk factors. The first being forceful movements combined with repetition. And then the third real hallmark is awkward postures. And when you combine those three major issues, we end up with issues. There are some other issues, of course, that can go into this. Static posture, staying in one position too long. Also, temperature, environment, all factor in. But the real hallmarks are when individuals, workers, are forced to work in positions where there's strong forces, moving their hands, arms, legs, in awkward postures repetitively over time. And when folks are not fit to those specific job tasks or job duties.
You know, I've been into a bunch of offices here and there, and I've noticed that there are several workers now who actually stand all day at work.
Office ergonomics is really a whole science into itself, and it's becoming more and more prevalent. But what we've started to notice is many people can't necessarily find optimum positioning in a seated position. So what we've started to do is emphasize more movement in the workplace, particularly office environment. And one of the ways we can do that is to allow for things like standing desks. Now many people think, great, just stand. It's actually changing position. And what a standing workstation allows you to do is adjust, sit and stand in real time. And what we can do with that is really de-emphasize the stresses on the body, allow people to move more, stay more active, allow blood flow, different positions. So it really is one of those things you're seeing more and more of. And I encourage anybody who works in a static office environment to try to explore that with either their employer or their safety rep, because it's definitely something that's becoming more and more commonplace. Costs are coming down, and it's not something that's out of reach for most employers or safety programs to start exploring those areas.
A friend of mine, John Leidecker, is an attorney for the NEA, and he has no chairs in his office. And he's actually designed and built all his furniture for standing, his entire office. It's incredible. So can non-work-related factors cause MSDs?
One of the things we try to teach folks is, in addition to the appropriate ergonomic positions in any workplace, we also have to look at other risk factors. Those are general deconditioning, obesity, diabetes. All these factors can make musculoskeletal disorders worse. It's not to say they're necessarily causal, but what we want to emphasize is fitness for the whole being. And so we definitely want to watch those, particularly in the general population as well.
I think I've probably done some of these jobs where, well, certainly meat cutting was very effective like that. We're handling a lot of boxes and things like that. But I mean, what types of work are they most likely to pose these kinds of problems?
Well, we see a lot of this in the manufacturing trades, also healthcare, nurses, orderlies, moving patients, but also maritime construction are high. We see this also in the trades involved in, general hotel industry, et cetera. So we're really seeing these across the board. The data is sort of fluctuating based on numbers, but the area that's growing more and more quickly these days is the office environment. That's where a lot of new attention has been focusing. So that traditionally was not expected to be a high ergonomic risk, but we've started to see that. But lastly, the real hallmark is the meatpacking industry, which you have experience in, and that's the classic forceful cutting, repetitive slamming that is required. The meat industry has actually done a great work in that, redesigning tools, using automation, et cetera, to try to limit those injuries to those workers.
It's also a very dangerous workplace.
Correct.
As well. Very dangerous workplace.
And that's an important thing to emphasize with any ergonomic intervention. Oftentimes any redesign of tools, equipment has to maintain certain safety aspects. So that's why any issues that a worker may bring really should be done as part of a comprehensive program where all aspects of safety are examined. And ergonomics is just one area of safety, but a lot of the work in ergonomic programs requires a comprehensive input from employees, employers, union safety reps, et cetera. It's not something we should be just doing willy-nilly. We really have to examine the whole program and what's going on globally with the processes. And one of the big tools that really has to occur first is what's called a job hazard analysis. And that's something that should be done routinely with a high frequency to maintain worker safety. And what happens there is it's a comprehensive look at all the risk factors that may be impacting negatively worker health and safety. And ergonomics is clearly part of that process or program.
Lift from the knees, not from your back.
There you go.
I've been hearing that all my life. I guess that's why I have that bad back, but I haven't been very good at that. So what would you say were the top 10 occupations where we have these musculoskeletal disorders? From
OSHA NIOSH data is really related to nurses' aides, orderlies, attendants, truck drivers, laborers in both construction, non-construction, also janitors and cleaners, registered nurses, stock handlers, etc.
Registered nurses?
Yes.
From dealing with lifting and with patients and that sort of thing?
Patient safety and handling is a huge issue, both for this.
Problem in nursing homes too. Where
yes.
An awful lot of that.
And that's a double issue, because you're not only dealing with the safety of the patient, but more and more attention is being focused on the safety of the person doing the lifting, the nurse or the nurse's aide. And how do we optimize both the safety to the patient, but also the safety to the employee? And hospitals are having to look globally at the issue. And lots of the focus initially was on patient safety. We're seeing really a shift to now expand what safe patient handling means. It's not just safe for the patient, it's also safe for the employee.
I did a lot of organizing in my career, did some healthcare organizing, and organized some nursing facilities here and there. And that was always a big issue for the nurses' aides, a really big, an important issue even in negotiations.
One of the things there's really, really expansive areas in products designed around those issues. Hospitals are appropriately so providing more and more fiscal and time attention to how best to move individuals, patients, with lifts, new devices to move patients, slide boards, et cetera. But it's really something that should be on the forefront of worker safety and healthcare. It's an area that I think has to be approached with all parties involved, and clearly, labor has a role to play in that.
How would I know if I have a musculoskeletal disorder?
You'd start with the job tasks you do, and one of the first areas that people start to notice, probably you had it, is when you started to do your job. You started to notice, at the end of the day, you start getting aches, pains. MSDs typically start with, chronic aches, pains, decreased range of motion, initially treated conservatively, but when conditions become chronic, you start getting numbness, you start getting tingling, that's when there's clear indication that an individual needs to either talk to their safety supervisor or report the injury as something that they need formal assistance with.
Can we really control these ergonomic risk factors?
Without full automation, probably no, but we can definitely decrease the risks. And that's really through good job design and appropriate risk assessment. And that, as I stated before, really requires a team effort. It requires employers to recognize their responsibility, employees to voice their concerns and talk about when they're having these issues, and also appropriate safety and health representatives from labor to get involved proactively before these conditions become too problematic and chronic.
What can I do as an individual to improve the economic or the ergonomic hazards in my own workplace?
It really starts with, like I said before, recognizing the tasks you do and looking at what assessments and what safety programs exist in your organization, and asking appropriate questions about can those be improved, and working with not only your coworkers but also with management and labor health and safety to see how help can be provided not only to an individual but to the group.
What parts of the body are most affected by these musculoskeletal disorders?
We traditionally hear about the hands, the arms, your issues with your hands, but it clearly does affect elbows, shoulders, back, lower extremities. So it can be pretty much any part of the body.
Yeah, I guess. Well, this has been a great show today. Thank you so much for coming in today, Dr. Okurowski. And that's it for this edition of Labor Vision. We'll see you next time.
Thank you for joining us for this edition of Labor Vision. We appreciate your input and encourage your comments. Labor Vision can be seen on this channel 3 times each week: Tuesday at 7 p.m., Thursday at 8 p.m., and Saturday at 5 p.m.